Once upon a time, John and Nancy were living the good life. As a retired couple, they'd achieved their lifelong dream of living in a comfortable home in a quiet suburban neighborhood, with their 3 adult children and 6 grandchildren not far away.
Then one day, their good life hit a roadblock. John was diagnosed with a life-limiting illness. Near endless doctor appointments, tests, and medical procedures followed the shocking report. John and Nancy did everything they could to fix the problem.
Unfortunately, as John and Nancy soon discovered, you can't fix a life-limiting illness. No medicine or surgery could reverse John's diagnosis, but all of the appointments, tests, and visits to the hospital did accomplish one thing: completely sabotaging John and Nancy's once beloved life.
Soon, 911 calls and emergency room visits replaced doctor's appointments. Nancy was determined and willing to help her husband, but she became overwhelmed by 24/7 caregiving. Now, it wasn't just John in poor health. Nancy was emotionally, mentally, and physically exhausted.
As John continued to decline, his needs grew beyond Nancy's capabilities. Their adult children took turns staying in the home to help with caregiving. Each passing day brought new challenges for Nancy and her children as they continually sought solutions for John. Their hopes of returning to the beautiful life they once enjoyed faded a little more every day.
Then something happened that changed everything. A healthcare worker introduced John's family to a completely different type of care plan. Ironically, this plan was not about fixing John. Instead, it had a singular purpose: helping John live his best life.
No more appointments, tests, or procedures. No more ambulance rides or spending hours in the ER waiting room. Best of all, the new care plan met John's needs right where he wanted to be most: at home.
Nurses regularly visited John and Nancy's home to manage John's symptoms and offer caretaking education for Nancy and the children. The family had around-the-clock on-call support, eliminating stressful 911 calls. There was even a certified nurse assistant to help with John's personal needs and optimize his quality of life, along with a social worker and a chaplain. Not only did his new care plan give John the medical help he needed, but it also gave Nancy a much-needed break and helped the whole family navigate the reality of John's diagnosis.
While John still had an advanced life-limiting illness, he now had a dedicated team of healthcare professionals, all committed to one thing: helping John live his best life in the comfort of his own home and surrounded by his loved ones.
What John and his family were now enjoying is the often misunderstood hospice benefit. John and Nancy were now experiencing what so many other families have discovered.
Hospice is about helping patients live their best life.